Hello, everyone. Welcome to the Beyond Breathing podcast, the podcast for everyone who breathes and sleeps. So far, you have heard episodes from breathing experts, myofunctional therapists, and patients who are conquering their sleep and breathing struggles. In this episode, we have a very special guest. We have Dr. David McIntosh, who is a world-renowned ear, nose, and throat specialist, lives and works in Australia. Dr. McIntosh has a specialty interest in the nose and sinuses, pediatrics, snoring, and sleep apnea. He is an internationally recognized ENT and the founder of the largest private ENT services in Australia. He strives to bridge this medical dental divide that you hear me talking about a lot, and is just playing a pretty crucial role in providing valuable education to the general public like us today, but as well as dentists and physicians. Not to mention, he's very active in his community, providing services, desperately needed ENT services to underserved children. I discovered Dr. McIntosh from basically stalking him on social media. I've read his book, Snored to Death, several times. This book just blew me away, and why I thought I wanted to have him have some time with you guys here today. This book is one of the best books I've ever read on airway, sleep, and breathing and whole body health. And he talks about how important it is for adults to assess their own breathing habits, but also encourages parents to be diligent about checking their children's sleep and breathing very carefully as well. And what I love about Dr. McIntosh and what I think you will find impressive is his passion, his wealth of knowledge, and all of the research and science and evidence from multiple disciplines, everything from ENT, sleep medicine, neuroscience, gastroenterology, sports physiology, dentistry, and orthodontics. And he's a pretty amazing advocate for just overall health. So it is my pleasure to introduce our guest today, Dr. David McIntosh. Welcome. Thank you. He is an ENT that specializes in airway and pediatrics and believes that teamwork make dreams work. So hi, welcome to the podcast.
Well, thank you. That's one hell of an introduction, but thank you all the same.
Well, I could have went on a lot more. You are very, very humble and kind for being here today. So since this book, Snored to Death, was really what sparked my interest, would you mind just kind of starting off talking a bit about snoring? Why we know that many people have sleep apnea and don't snore. We know that many people do snore, and that snoring is very dangerous, and it's kind of become normalized, I think, in our society. So why don't you just tell us exactly what is snoring, what causes it, and why is it potentially life-threatening?
For sure. So, snoring obviously is a noise. Now, it's a noise that relates to the time when we're asleep. There's different noises at different parts of the day. So, we designate snoring related to when we're asleep. We actually have names for noises that relate to when we're awake as well. But let's just deal with the snoring bit. So, we fall asleep and we start snoring. Now, snoring is a noise that is made for one of two reasons. It is either because there is something blocking the airflow through the upper part of the airway, or there is something within the upper part of the airway that is moving and shaking around. And both of those things are actually problems. Now, the big one is that's the problem is when there's actually due to a blockage. Because if it's due to a blockage, that basically means that you're choking. You may be choking a little bit, you may be choking a lot. And people often say, look, is a little bit of snoring okay? And I say, well, is getting hit by a little car okay? We're just talking about degrees of the problem. We need to acknowledge that is a problem. That's really, really important. And then just to look at, the one where, all right, it's not so much that things are blocked, but things are vibrating and shaking around. One of the things that happens when that happens is we get these little micro traumas that happen. And because of it's within the throat, that micro trauma, one part of the body that it affects in particular is the blood vessels. So people might have heard about with blood vessels, you get a little injury that can lead to a tear in the blood vessel wall lining. And that can lead to, for example, some bleeding inside the wall of the blood vessel that can lead to a stroke. Well, that's exactly what can happen here. So either way, whether it's due to obstruction or whether it's just noisy breathing at night, there are health implications galore when it comes to snoring. And that's why I use the title Snored to Death, because snoring by itself, with or without sleep apnea as being the icing on the cake, increases your risk of an early and premature death, and or having a significant problem such as a stroke that can leave you significantly incapacitated and ruin the quality of your life.
Yeah, could you go through and maybe just from head to toe do a brief overview on what different parts of the body, besides increased risk of stroke, what other impacts are done in the body, kind of from head to toe with snoring? That's unfortunately insidious, right? It's happening and we don't know that it's happening.
Yeah, absolutely. So one of the ways that we break the body up anatomically is, as you said, by head to toe. The other way that we do it, which I might just defer to, is breaking it up into body systems, because the body systems can stretch a whole stretch of things. So we talk about one. So I've talked about one part of a system, which was the vascular system, but that's part of what we actually overall call the cardiovascular system, which is the heart and blood vessels combined. So I mentioned stroke, but we'll add heart attack into that list. We can add heart failure into that list. We can add high blood pressure into that list. Just as simple examples, we can have this thing where the heart rhythm, so the electrical wiring of the heart, can be aberrant, and that's what we call an arrhythmia. So if you've ever heard, people say that their heart, rate went all kind of crazy, well, that's called an arrhythmia. So that's the cardiovascular system. The gastrointestinal system starts at the mouth and finishes down at the butt. And from there, anywhere in between, we can have problems. So we can have problems, which I see a lot of because of the work I do with the dentists, in terms of jaw and teeth. So you have, for example, mouth breathing, so you get dental decay. You get low oxygen, you get teeth grinding, so you get dental wear from there. Having sleep apnea increases the chances of having a condition called reflux, which is where the stomach acid comes up. And reflux can make sleep apnea worse. So you've got a bit of a vicious circle there. And reflux, apart from being irritating into the throat, is also a risk for throat cancer and esophageal cancer. So reflux is not good for you. Then going down, we can have problems with, and we're still learning about this, but the gut bacteria. So with the gut bacteria, we have a very, very simple understanding at the moment of it. And we basically talk about good and bad bacteria. And if you have sleep apnea with the low oxygen, that favors the growth of the bad bacteria. One of the knock-on effects with having bad bacteria relative to good is the way that the gut functions. And one of the side effects of that is putting on weight, which again then increases your chances of sleep apnea. So you get this vicious circle thing going on. So there's a few examples there for you. Another body system that we talk about is the respiratory system, which is the breathing system. And apart from sleep apnea, which is a disease of the breathing system, it can increase the chances of another breathing condition known as asthma. So asthma can go up, and having asthma with sleep apnea is worse. Asthma then is also associated with hay fever, allergies, and having hay fever and allergies can make sleep apnea worse. So you're probably getting the gist and vibe here about how pernicious this condition is, just in terms of how you can have one thing that makes the other thing worse, that has a feedback loop on itself, and things just start to spiral. Then we have the neurological system, so the brain. So the brain craves oxygen. It's a crucial thing. It actually takes up 20% of the body's blood supply. So every time the heart pumps, 20% of the blood from that pump goes to the brain. The brain is a very selfish organ because it's only about 10% of the body, but it's taking twice its allocated share of the blood. And obviously, it's there for a reason. It's such a metabolically active part of our being. So having a good, steady supply of oxygen is crucial. And when it doesn't get it, it doesn't do so well. So I talked about the strokes because of the blood vessel problems, where you can get the strokes because of the oxygen flow problems too. The other thing that happens is because it interferes with sleep itself, that then affects how the brain functions. So a lot of brain function is actually absolutely crucial in good sleep. So things like learning, behavior, memory are all contingent on good sleep. So that's why, as you alluded to, we emphasize this in kids as well. So that kid that's waking up tired, struggling at school, maybe getting a label of ADHD, it may just be because that child's not breathing and sleeping properly so well. So there's some examples there. We talk about, we should talk about, the biggest body organ that we've got, which is actually our skin. And we've heard of beauty sleep. Well, it is beauty sleep for a reason, because not only do you look a little bit haggard if you haven't had a good night's sleep, but it's actually slowly but surely destroying your skin. So you go 3 nights without good sleep, and then we do little biopsies and test this in the lab. Your whole collagen and elastin, which is the thing that makes your skin soft, supple, and then lets you lie about your age. And then we cheat later on using botulinum instead. Well, that's all comes back to sleep again. So there's just a sample of things. I mean, I can go into a whole range of the other body systems as well, but really the take-home message needs to be that having sleep apnea is an absolute perfect storm when it comes to the disaster that it wrecks on your body.
Yeah, I think one thing that's been really fascinating to me recently is the kind of new connections between, breathing, sleep, and mental health, being able to have attention and focus and being able to regulate our emotions and things like that. Would you just elaborate a little bit? You touched on it with ADHD. Would you just elaborate a little bit with some of the symptoms that we can see in children that may indicate that they might be struggling with breathing issues and maybe the child or the parent doesn't know it?
For sure. So the way I look at this is that it's not the parent's fault. First of all, that child doesn't come with an instruction book. Okay. So you're doing the best you can. The second thing is they don't come with, a whole panel of indicator lights. So, you're driving your car and there's a problem with your engine. Well, there's a light that comes on and you go, I don't know what that light means. So you go and see the mechanic and they say, that's the engine light. And then they find the problem and get it fixed before it becomes a major engine problem, for example. Well, your child doesn't have that, so this is the little indicator light that you have to pretend is there. So let's work on daytime first, because that's the thing that you'll see first, and then you've got to go and look at the nighttime stuff to sort of put two and two together. So from the daytime point of view, the easiest starting point is to look at the first thing in the morning. If a child is waking up tired in the morning, there's a problem. It may be a sleep quality problem, it may be a sleep quantity problem, or it may be a completely incidental other medical condition. But either way, waking up tired is a major red flag when it comes to kids. Okay, so that's your starting point. So when I have these conversations, I go, "Oh, does your child wake up tired?" And they go, "Oh yeah, all the time." Like you said, it's all just been normalized, as opposed to, oh my gosh, yes, I do, and I've been so worried about it, which should be the response that we need to get parents on board with. So easy start, waking up tired. And then when they wake up, they could be slow to get out of bed. They have dark circles and bags under their eyes. They've got shocking bad breath first thing in the morning because, for example, they've been mouth breathing through the night. They may be complaining that their nose is all blocked and congested and it's all a little bit sneezy, which would tend to suggest they're getting some allergy problems, and some allergy problems are just happening at nighttime. And then you notice the tail end of it first thing in the morning. So there's the starting point. And then obviously it depends on the age of the child. If the child is school age, then that's the child that's having trouble with their concentration and their focus. Their learning is off track. They're in the bottom part of their class. They're disruptive. They may be showing behavioral problems such as anger, management, aggression, body, emotion regulation problems, for example. And obviously we can see that in the younger kids too. They can have problems with, going to the younger age now, speech development. They get the broken and disrupted sleep that really just sets them up for failure. They end up needing naps through the day, far beyond the ages then that they should, be having to need them in the first place, which usually is up to about the age of 3 or 4. So, we can see those sorts of things coming on. So, concentration, behavior, emotions, education. And the other one is just their general physical activity. So, over here and over there, soccer is becoming a big one. So, that seems to be the one that comes up more and more these days. Because, it's a little bit different to your American football style. Your American football game is stop, start game. So, you get those little rests in between. But if you ever seen kids run around play soccer on the field, it's just go, go, go the whole time. So it's a really good indicator, compared to American football, for example, where because they're having to go all the time, these kids are tapping out. They just cannot get out there and run and play with the rest of their fellow kids. And it's not because they're lazy. It's not because they're unfit. They're just their whole what we call physical capacity or endurance is mucked up. Simply because their cardiovascular system and their respiratory system ain't working properly because of what's going on at nighttime. So there's some examples there in terms of the general thing. I did, as you said, mention ADHD, but I'm going to mention the whole gamut of mental health problems just off the top of my head that are noted to be exacerbated and then in time become more prominent. So, for example, more so in adolescence, but if you've had sleep disordered breathing as a child growing up, you're more likely, even by the time you're an adolescent, to have depression, anxiety, schizophrenia, bipolar affective disorder, a psychotic episode, and if there's been trauma in your life, post-traumatic stress disorder. It also leads to the manifestation of autism spectrum disorder like symptoms earlier on. And as you said, I've mentioned the ADHD. Now, that's one heck of a list when it comes to mental health. So there's sort of the red flags. And then, like I said, that's your daytime thing. But then you got to go and do some nighttime homework, because often if the children, the parents put them down at night, they're down one end of the bed, the parents get to have some own adult time, watching TV, etc. They don't really know what's going on with the kid, but this is where you got to go and find out. So what I tell parents to do is you got homework, you got 2 weeks, every night, about 10, 15 minutes at random time through the night, pop in and have a look. Is your child snoring? Is their mouth open or closed? Are they restless, tossing and turning? Are they sweating? Do they have moments where they stop breathing at night? And then, the parents may have already have a clue, but not realize it was a clue. That child is waking up through the night and comes into the parents' bedroom several times through the night. And eventually the parents just give up and just, leave the child in the bed and wave the white flag. But that's a possibility. Does the child sleepwalk, sleep talk, grind their teeth, having night terrors? These are all indicators, once again, that this child is getting poor quality sleep. As it comes down to, again, like I said, the cause and the most common cause, the biggest, what we call sleep disorder. So, problems of, the body systems and so forth, problems of sleep, we call it a sleep disorder. The biggest, most common sleep disorder in children is what we're talking about right now, this problem with breathing it. And that's where then you start going on a journey to work out the cause.
Oh, excellent. Well, we talked about, I guess, how many red flags, signs, and symptoms are there, and either we ignore them or we don't know what to do about them, or we've just normalized them. How about the other end of the spectrum when parents or even adults know that something is wrong and they have a hard time finding somebody to diagnose them or assess them or treat them. So one common frustration that many people, including patients and people like me and you, airway providers, we often hear things like, why has no one ever told us before? Or, I've taken my child to their primary care doctor, their urgent care doctor, or even ENTs, and we've been told to watch it. They'll outgrow it, we'll wait, or they need to get a certain number of infections per year before something will be done. I know you have a very different mindset when it comes to treatment to achieve optimal health and early intervention. And you put something in your book that I thought was pretty amazing. So I'd like you to expand on that too, this idea of no more complacency or management by neglect.
Yeah.
Share with us your mindset about when to intervene, how to intervene, and how important is it to do it as early as possible?
Yeah, absolutely. So let me unpack all of that for you in a simple method. When I went to university, all right, when I was a boy, this wasn't even a conversation of sorts, okay, at all. In children, it wasn't even a thing, okay. And I'd like to think I'm not that old, at least not yet. So part of what happens in all aspects of healthcare and general professions is that there's always new knowledge advances and so forth. So, for example, when I went to university, I think there were probably, in fact, I know for certain there are only 3 drugs for diabetes. Okay. Now there's gosh knows how many. So, but I don't specialize in diabetes, so it's not my job to focus on that side of things. But my point being is that there's so much, progress, knowledge, and information that comes out there. It's like trying to fend off a tsunami of knowledge with an umbrella. you're just going to get overwhelmed. So part of the problem is that people have different foundations of knowledge depending on where they were at when they actually went to university and did their medical training and so forth. So, if they sort of went through when I went through, then this topic is something that may absolutely blindside them if they haven't come across it at all before. And again, I don't take that as being their fault, because you can't be on top of everything. So, ENT, I'm not on top of all of ENT. I am an ENT, but I'm on top of the bit of the ENT that I focus on. So that's sort of part of the dynamic as well. So, and the frustrations, are real as to what you're describing because of the paradigm. So, when we look at why we do things as an ENT, very simply, 80% of the time, it's only for one of two reasons. It's either because of infection or it's because of obstruction. Okay. You might have a blocked ear or you might have an infected ear. You might have a blocked nose or you might have an infected sinus. Likewise, you might have infected tonsils or blocking tonsils. And the important word there is or. These are two different things that can affect the same part of the body, but they are both independent reasons as to why we do things. And the thing is about the infection, I mean, the reason that's the common one is because that's the easy one. That's the low-hanging fruit. It's really obvious if your kid's getting repeated bouts of tonsillitis because they're getting sick, they're getting sore throat, they're getting temperatures. You're seeing your doctor who's seeing pus on the tonsils, who's giving them antibiotics, who then after a couple of days, they come good again. Tonsillitis, that's an easy diagnosis to make. Straightforward, no problem. So as a result of that, historically, there's a conditioning process where tonsil problems equals infection. That's what I know, so that's what I fix. However, what's got lost, and this is why we need to bring it back into the realm of knowledge, is that big tonsils and infected tonsils are two different things. Okay. So, if you broke your nose, we wouldn't say, well, you haven't had a nose infection, so we don't need to fix your broken nose. You'd be like, well, it's broken. It's been smashed up. It's like, oh, no, but it hasn't been infected. It's the same logic, which clearly doesn't prevail in that scenario, but it does unfortunately prevail in this one. And why is it important to get fixed early? Well, when particularly we're talking about children, hate to say it for all the adults out there, but the brain activity of a child under the age of 6 is probably 3 or 4 times higher than that of an adult's. The reason being is they're on a learning curve. So our knowledge that we acquire as adults from day to day, generally speaking, is pretty small compared to what a child is exposed to. They are learning, from the very beginning, they are learning to feed, then they're learning to walk, then they're learning to talk. And then they're at school and they're doing reading and writing and arithmetic, the 3 R's. And, there's so much knowledge and information that they're presented with and challenged with that then they need to accumulate and assimilate and then use the next day to then go up the ladder. And if they're not getting good sleep and they're not breathing properly, those two things independently and then collectively have an impact. The child waking up tired, their concentration and focus, it ain't going to be there. And then we start going into the weeds where we actually start looking from a research point of view and running these kids through brain scanners and just going, hey, let's look what their brains look like. What are their brains doing? Because everything that we see right now, what you're doing, what I'm doing, that's a manifestation of brain function. So at the moment I'm talking because I learned how to talk. I'm holding my phone because that's how we've worked out to do this communication from afar. And I'm using all the knowledge and information that I've accumulated over time and sharing that with you in a way that, others are then listening to and they're using their brains. So there's a whole brain network thing going on here. And when we scan the brains of these kids, we see some really concerning things. We see parts of the brain that are not working properly. We can now these days we can actually look at the brain connection network. So if you've ever gone to, for example, a train station or a bus stop and it has a map of the bus routes or the train routes for your whole city, well, the brain is sort of the same thing. And we can actually look at those brain networks now and we can see problems with those brain networks. The brain is not as connected as it could or should be. So, there's major problems there. We've got different outposts of the brain, and the communication channels are nowhere near what they should be. And that's particularly interesting too in the ASD conversation, where we see these aberrations. So, when do you fix it? Well, this is where science comes into the story, because basically we've got a group of studies where they've looked at kids and worked out the time frame that the children have had airway problems for, and then looked at when those airway problems were fixed, and then looked down the track to see how those children went. And we have two really important things that come out to bear. The one is the age of onset, and the second is duration of exposure. The kids that have the worst long-term outcomes related to the age of onset tend to be the kids where it starts under the age of 18 months of age. So that right there throws out the whole "they're too young to get fixed" scenario. They're actually too young to be having a problem. Okay, they're not too young to have the solution. They are way too young to be having the problem. The next time point is the age of 4. The next time point is the age of 6, and then the next time point is the age of 12. So as you move through those ages and stages, they're your relative risks in terms of age of onset, as to then long-term outcomes being bad or good. So the younger it starts, the worse things are likely to be in the long run. That's the first thing. And the second thing is duration of exposure. And this seems pretty consistent regardless of age, and that is 6 months. 6 months of having disrupted breathing, disrupted sleep seems to be enough for then to lead to these brain changes that we can see on scans. And some of these changes are still reversible because the brain has this thing called neuroplasticity, which allows it to develop and so forth. But it needs to recover in the right circumstances. And if it's been longer than 6 months, that recovery process doesn't seem to be complete as good as when it's addressed under 6 months of duration of exposure. So they're the important take homes in terms of what you're reflecting on. And we used to have this scenario where we said they will outgrow it. This is partly true, is that we know that half the children will outgrow the airway obstruction by themselves. So you go, well, hang on, well, why aren't we leaving it then? Well, first of all, we don't know which half of will and won't. We're not sophisticated enough. And then when we look at that half that, in inverted commas, now outgrew it, and look at their learning and look at their behavior, it is not as good as children who had the airway problem and got it fixed. So the airway problems in both groups, those that get it fixed and those that outgrow it, is the same, but the outcome, because of the duration of the exposure and then the timing of intervention, is different. So early problem, early fix, much better long-term outcome.
Yeah. So I'm a dental hygienist who is airway focused. What role do you think that dentistry plays in all of this airway assessment and early intervention and assessing for growth and development?
Huge. I know you asked me a rhetorical question there.
Yeah.
So the profession that spends more time than anyone else looking inside the mouth, apart from ENT, but even then you probably still beat us, is dentistry. Okay. And then because you're working through the mouth and so forth, inadvertently forcing people to breathe through their nose. Now, you shouldn't be forcing people to breathe through their nose. It should be a natural thing. But for those that can't breathe through their nose, they're the ones that start to struggle in your chair. And, they're the ones that are coming to see you because of their bad breath. They're the ones that are coming to see you because with the mouth breathing, it's affecting their teeth. They're the ones that are seeing you because they're grinding their teeth. They're the ones that are seeing you because they're getting reflux damage to their teeth. They're the ones that are seeing you because they're getting jaw growth problems. So this whole thing about, I want my child's teeth straightened, because I can see that their, teeth are crooked, is sort of, often a starting point of conversation. What the parents are then blindsided by is how having breathing problems, particularly mouth breathing, increases the chances of those teeth and jaw problems having come about in the first place. So part of, the whole thing that I go on about with orthodontics is that there's a massive overrepresentation within that cohort of the population presenting for please fix my crooked teeth with an underlying breathing problem. We're talking about, in the general pediatric population, a condition that affects maybe sort of anywhere between 10 to 20% of kids. But if a child is one that has crooked teeth and seeing an orthodontist, if that child is just, as a group, those children are assessed for airway problem, anywhere between 40 to 80% airway problem. So that's a significant overrepresentation compared to the general population. So if we, you should add that to our screening program of health conditions, is basically crooked teeth, ask about airway. So dentistry is crucial because, again, with myself being a medical person and the way that healthcare is compartmentalized, we don't get training in dentistry and jaw and teeth problems. Now, over time, I've kind of get to know a little bit about it. So that's, doing okay there. But it's not general medical education. And as a result, there's a whole swathe of things that you will pick up in the dental chair that a medical doctor would have no idea or insight or understanding into. So from that point of view, absolutely crucial. And this is what I sort of talk about. I talk about having these, think about it, like we've got a wall around a city and we go, well, how many guards do we want around there looking for problems? Well, we want as many guards as possible.
Mm-hmm.
We can ENT guards, we can have the medical guards, we can have the dental guards, but I want the chiropractic guards. I want the teacher guards. And then ultimately we want the parent guards, but they're going to be the last ones to the party. Because again, you don't know what you don't know, but doing these sorts of things, the way I look at this, even there's just one parent out there that, trips over this and goes, oh my gosh, that's my child. And this, then they get proactive and they go, I am not going to take no for an answer now. I knew there was something wrong. I thought what I was told was okay. But I know better now, so I'm going to do better now.
Oh, Dr. McIntosh, thank you. That was amazing. You went above and beyond in educating us and inspiring us and motivating us. I just want to encourage our listeners to buy this book, Snored to Death. It is a phenomenal book. You can find it on Amazon. It's an easy read. It's jam-packed full of information. Before we sign off, Dr. McIntosh, is there any other resources or any other books or anything that you would recommend for our listeners if they stumbled across this and were kind of blown away like I am? How do they learn more?
Yeah. So, we have this beautiful thing called the internet, obviously, but that's a blessing and a curse because you can find all sorts of things. So I guess, step one, stick to reputable sources, so if you're reading something that's a reputable source, established university type stuff, that's better than someone's blog. That's going to be, varying degrees of reliability there. And I guess for parents, one of the things I did, being mindful about how you can get buried in medical terminology, and sort of just also just wanting or needing a roadmap. It's like turning up at a city and going, how do I get from A to B? Well, you bring it up on a map. So I wrote another book, which is called Sleep Disordered Breathing, A Parent's Guide. Same deal, find it on Amazon. And it's relatively straightforward read. It explains different things that we haven't gone into too much detail, like the ENT problems, the dental problems, the myofunctional problems. It talks about what we do to fix it, and then we talks about, well, if we do that fix and it doesn't work, or it works but then problems come back later on, what we need to look at. I go through that so that parents have this resource there so they can actually be their advocate for their own child and get their child seen to and fixed. And no more management by neglect. We really need to change the paradigm out there because we are talking at the end of the day about brain damage. There's a reason we don't let children play with mercury. It's not good for their brain. Well, we shouldn't be letting them having breathing and sleep problems either.
Oh, thank you so much. That was the perfect way to end. And I want to thank Sierra Sleep, Airway, and Wellness Center in Reno, Nevada for sponsoring today's podcast. And hopefully, Dr. McIntosh, we can have further conversations. And I'm going to be ordering that book as soon as we get off the podcast. So thank you so much.
Real pleasure. Thank you.
Bye-bye.